There are 8 themes, 4 that are caregiving themes and 3 that are nursing themes. The 8th theme is a general theme. The caregiving themes are communication, autonomy, respect, and maximizing capabilities. The nursing themes include safety, infection control, and observation. The 8th theme is a general theme of care, time management. Managing your time will ensure that you conduct your work in an efficient manner. By learning the skills the way they are demonstrated, with attention to each of these 8 themes, you will be balancing the art and science of caregiving. Each of the skills in this video is organized into 4 parts. 1. You will consider your residents' capabilities. 2. You will prepare and get ready to do the task. 3. You will do the task or procedure. And 4. You will complete or finish the task. For each skill or task you perform, you should start by preparing yourself, your resident, and the environment by obtaining and organizing your equipment and considering the care plan, residents' preferences, and common preparation steps. You will be seeing this icon appear at the beginning of each skill presentation. It will be a reminder to always consider the preparation steps applicable to your resident. The most common preparation steps you will use are checking your resident's care plan, knocking on the door and waiting for permission to enter, introducing yourself by name and saying you are the nurse assistant caring for them, checking your resident's identification according to your facility's policies, telling your resident what you would like to do and asking if the timing is all right, determining your residents' abilities so you can maximize their capabilities and determine what equipment is needed, explaining what you're about to do, gathering supplies located outside your resident's room, gathering supplies that belong to your resident, preparing the equipment and environment, providing privacy by closing the door or pulling the curtain, washing your hands before preparing the environment if needed, and always before touching your resident, wearing gloves, goggles, mask, and gown when needed, offering help with the task but only as needed, using the proper container to dispose of dirty items, observing your resident and asking yourself about anything you observe, talking to your resident while you're performing the task, talking to your resident about anything they may need. This video will demonstrate how to perform more than a dozen procedures you will use every day. Each procedure is shown step by step. In each procedure, you will see how the nurse assistant balances the art and science of caregiving. After you have finished performing a skill, there are suggested completion steps that will enable you to practice the 8 themes of care on a daily basis. You will be seeing this icon appear at the close of each procedure. It will be a reminder to always consider the completion steps applicable to your resident. The most common completion steps designed around the 8 themes are completing the skill without any distractions or interruptions and using good body mechanics, providing for your residents comfort, making your resident comfortable with proper positioning and body alignment, checking with your resident to be sure everything is satisfactory, putting the call light or other call device close to your resident, making sure the bed is lowered, disposing of all used items in their proper containers, removing your gloves and disposing of them in the proper container, washing your hands, recording the completed procedure in your resident's facility records, reporting any changes in your resident or the environment to the charge nurse. Remember the saying, It's not what you do, but how you do it. Or did you ever hear, anything worth doing is worth doing right? Care for your resident considering both the quality of your caregiving and the quality of your resident's life. The themes will be your guide for performing all skills beginning to end. They will help you always give quality care. Imagine you are your resident with a chronic disease. Every day can be a challenge. In some cases, the only person they can count on is you, and the hope that you will care.